Welcome to the Palms Up Show. We're just waiting to go live any minute now. Well, palms up, and welcome to the Palms Up Show. It's your girl, it's your girl. It's your girls, it's your girls. We're back. And boy, do we have a show for you this evening. Will you do us a favor? Will you share the feed, please, and get folks to the table? Let them know that we're talking to representatives from the Unity Healthcare here in the Washington, D.C. area. As you know, we've got quite a bit going on in our dear city. Did you know that Unity Healthcare workers were facing such injustices, which is obviously impacting their ability to take care of our citizens? We have over 90,000 citizens across the district, both incarcerated and homeless, that that depend on, I should say, the Unity Healthcare services and the physicians. I've got a wonderful representative from Unity, Ms. Kate Sugarman, on the line this evening. And Kate is going to give us an update as to what's been going on. And they need our community voices because they've been trying to get help with the union and negotiating with top Unity officials. They just want three things, three basic things. They want safety in the workplace, and anyone administering healthcare in a jail setting and in some of our communities in the city, they should have safety, don't you think? Do you have safety on your job? The other thing is transparency. They want to understand, how is it that top level officials always make all the money, and then the bottom level folks take all of the deal with all of the drama, as you're going to hear Kate talk about this evening. And then they want an ability to see lesser patients. You know, some of the doctors are expected to see upwards of 1,700 patients. That's ridiculous, guys. So I want you to know that in the nation's capital, there is so much going on and so much required of us to keep speaking up. As you hear me say all the time, if you don't stand for something, you're going to fall for anything. Palms up. It's your girl. And if you want to join the discussion, you can go to www.healthydcandme.org. Click on the link and come on and let's talk, DC. Let's talk. There's some doctors and some workers in our town that need assistance. And did you know that Unity Healthcare was created back in 1985 by Dr. Bessie Barber and Dr. Janelle Beckus? I don't want to mispronounce her name. I want you to know that they started a healthcare for the homeless, and what has now today become Unity Healthcare, and they've got clinics across the city. And welcome to the platform, Overseer Coach. You know, we had this up on hiatus for a few months while we were hopping on the ground, so we're a little rusty. But come on with the word this week before we introduce Kate.
I chose the word for today, the whole armor, because we need it with this craziness that's going on with these jobs and people's lives. We really need the whole armor. So it's Ephesians 6, starting at the 10th verse. Finally, be strong in the Lord and in his mighty power. Put on the full armor of God so that you can take your stand against the wiles of the devil. For our struggle is not against flesh and blood, but against the rulers, against all authorities, against the powers of this dark world, and against the spiritual forces of evil in heaven realms. Therefore, put on the full armor of God, so that when the evil day comes, you may be able to stand your ground. And after you have done everything, to stand. You on mute, Rhonda.
I'm muted out. I said absolutely put on that full armor, God, palms up. Thank you, dear overseer, for the word. I want to read something to you guys. Dr. Sugarman was kind enough to share the following, just to give you a little bit of the behind the scenes, and then we're going to open it up so that she can help us understand. As Dr. Sugarman received the following message, it was a distress message. And when I saw it, I knew we had to bring this matter before the Palms Up audience. And so we're depending on you all to share the feed and help us get this word out. It says, hi, Dr. Sugarman. I'd like to work with community members on the unjust and inhumane manner in which we had over 40 staff members laid off a week before a union vote, mostly women and Black and POC, and we're going to find out the POC. We're told that they no longer had a job. Can you imagine? No communication since the rest of the staff. So we reached out about how poorly this was done. Statements by leadership made that this doesn't impact providers or patient care. How in the world could that not affect providers in the care for the patient? Says our hearts are breaking for our staff and our anger is rising for our community. We need to move and action now. Otherwise, it will just be another case of injustice that's allowed to happen because people stay silent. Palms up. Guys, without any further ado, would you please give your undivided attention to our wonderful guest, Dr. Kate Sugarman with the Unity Healthcare System, who's going to help detail to you exactly what's going on here in the nation's capital. Hey, Kate, welcome to the Palms Up platform. And Palms Up is just our way of giving gratification to the powers above, powers that be. Palms Up is a call to action. Palms Up is just thank you, Jesus, for another day. Palms Up is just very well said. It's appropriate in all settings. So I want to welcome you to the Palms Up show. And I would like to invite you to help Palms Up listeners understand exactly who you are with the Unity Healthcare Network, how long you've been there, just how we got here, if you would. And thank you, Kate.
All right. Well, thank you for having me. And so a little background, I am a family doctor. I'm also a community activist. I have been with Unity since 2010. And Unity's background, Unity Healthcare, it started as healthcare for the homeless many decades ago. And the DC government at that time was providing much of the primary healthcare for DC residents. The DC government decided that they no longer could do that, and they outsourced primary care to Unity Healthcare. So Unity Healthcare has an obligation to DC's low-income residents, DC's vulnerable residents. They have the contract for healthcare for the homeless. They also have the contract for the DOC, Department of Corrections, for the jail. So, despite the fact that they're no longer providing their obligations, they're just acting with impunity. So, as you know, we worked very, very hard during the pandemic. We put our health at risk. We came in and, really, really put our health at risk, worked extremely hard during the early days of the pandemic, all through the pandemic. And the thanks that we got was that the management sent out an email, which was a lie. About a year ago, they sent out an email saying that they were in the red, that they were losing money. And despite the fact that we were working very, very hard and seeing a large number of patients, they said we had to dramatically increase the number of patients. Well, it turns out in reviewing the records, they were not losing money. They were just lying and trying to abuse us and make us see more patients than was safe. It's not safe for patients when doctors and medical providers, nurse practitioners, have to see a large number of patients. It's not safe. The patient care is not safe. So the response was that the medical providers unionized. It's a union called UAPD, Union of American Physicians and Dentists. We voted overwhelmingly to join the union. That was in about end of November. And the typical tactics of management are to stall the negotiations. Negotiations, so we don't have a contract. We're not close to a contract. Bargaining is just a joke. They were using the extremely expensive law firm Littler and Mendelson, which is the law firm that is the union busting law firm of Starbucks. My question is, who's paying for this very expensive law firm? Unity claims they have no money. We know that they don't. They do minimal grant writing, minimal fundraising. We know that the burden of Unity's budget falls on the providers. So it falls on us to see as many patients as humanly possible. And most of those visits are reimbursed by public insurance. So really, it means that Medicaid And your tax dollars and my tax dollars are paying for these really expensive lawyers. This needs to be investigated. Well, it only gets worse. Tuesday night, I was feeling so good. It was exactly 7 days ago. We had a community support event with many of you on this call at the event, a large showing of community members and union members and community activists. And I walked out of there feeling so good. I walked into work Wednesday feeling so good, and work looked like a funeral because very abruptly, we don't have exact numbers. We think it was 46 members of the support staff were abruptly laid off. How were they laid off? They were told to show up Wednesday morning at the very luxurious corporate headquarters. Unity Upper Management has a very luxurious, large, spacious, mostly empty office space on New Jersey Avenue at the Southwest waterfront. They claim they're stuck in that property, that they have a 30-year lease. I've never heard such a thing. And trust me, they have access to expensive lawyers. I bet somebody could negotiate them out of that lease. But these 46 poor souls were called in, told under false pretenses. They were told, come to New Jersey Avenue for a training. They got to this alleged training. Surprise, you're out of a job. And so not only that, but they were forbidden to go back to their clinics and collect their items, collect their objects. They were told maybe one day a security guard would collect your objects. Can you imagine if you have medication, if you have personal hygiene, if you have anything valuables, you're going to trust some stranger to go collect your objects? So they're banned from re-entering the building. Well, the timing, it was very suspicious because they were abruptly fired 6 days before they were about to have a union vote. So the support staff, which means medical assistants, front desk receptionists, who are voting whether or not to join 1199. So, many of the 46 were, just about all of these 46 people were people who are about to, have their union vote, which will be tomorrow. And then it just continues. The shenanigans never ends. You would think management would care about providing care for sick people. Our mandate is to provide medical care, for the sick, the low income, you would think, but no. Management decided after firing those people that they would be banned, not only banned from entering the building, but banned from voting. The NLRB, the US government body that controls matters of unions, the NLRB got involved and told Unity Management, since these people are already on the union list of voters, since they've already been approved to vote, since the firing was so abrupt and sudden, that those 46 people are still allowed to vote. Unity has violated the federal law by telling those workers, telling their security guards, giving the security guards a list of the fired people, saying these people are banned from entering the building. Well, we will see what happens tomorrow. The vote is tomorrow. They're only allowed 1 hour to vote. I'm not even scheduled to start that early. I work late tomorrow. I'm coming in as a volunteer. 1199 is having people come in, but Unity has already made their announcement to ban these people, which is a violation of federal labor law. The cruelty just never ends. Many of our coworkers, those who are not fired, have been moved around like pieces on a checkerboard to different Unity clinics. Our clinic is language-wise the most diverse. We have a large Ethiopian. I'm at Upper Cardozo in Columbia Heights. We have a lot of Ethiopians who speak Amharic. We have a lot of Spanish speakers. And in the cruelty of upper management, they took long-serving medical assistants who are Spanish speakers, who are Amharic speakers, and moved them to sites where all the patients speak English. It's just the cruelty never ends. And not only that, but all of a sudden now they have a brand new law firm. So instead of Littler and Mendelsohn, now they have a law firm called Morgan and Lewis, which is the union busting law firm from Amazon. And now that they have a new law firm, they claim that they can't bargain with us because the new lawyers aren't ready. I was supposed to attend my first bargaining session yesterday. Bargaining sessions have been canceled for the entire month of August. So that's where we are, but we are fighting. The dirty tricks never end. For instance, they told management told three people tomorrow that, oh, you can't go vote tomorrow because we're sending you to a mandatory training. Well, there's been a huge protest about that, and now those people don't have the quote mandatory training, and they can come vote. But the dirty tricks just never end, and we're very grateful for the community support. The mayor needs to hear about this. The DC Healthcare Finance Office needs to hear about this. The city council needs to hear about this. The board of directors knows, they don't care. They've done nothing. So, the DC government needs to hear about all this.
I
And again, thank
agree.
you for your support.
Oh, no, no, no. Of course you have our support. And as mental health advocates, of course, when we heard this, we were outraged because typically on the community level, when we think about mental health exposures and these types of toxic environments, we're more so focused on the citizen. But the first thing I thought about is what must it feel like to be a physician providing care under such duress and having your own mental, diminishment around these games that are being played. I saw something. We've been meeting in the background, and I thank you and Carrie and Jimmy for helping us to understand this on the community level. But I heard physicians say something along the lines that we're seeing an average of 20 patients an hour. Is that accurate? You're muted.
It's not 20 an hour. It's not 20 an hour. They want us, I don't know. They're always changing the goalpost. They want us to see maybe like 26 in a day. But a lot of the mental health is just, already 32 doctors and providers have quit. So a lot of people have just quit. It's certainly very disheartening. I'm just very lucky that I'm able to kind of keep up my spirits. But a lot of people's response has just been to quit. And most people, they're not even trying to hire people. Nobody wants to work there because the conditions are so dreadful. But I'll give you an example of just how very, very dysfunctional upper management is. There is a doctor who signed up in February to work. I mean, nobody wants to work there anymore. There is a doctor in February who signed up to work. They still have not processed his paperwork. So whatever their intentions are, they are driving the clinic, the whole system over a cliff with their foot on the accelerator. Without patients, without doctors, the clinic can't function. Our money comes from Medicaid and insurance reimbursements, and the buildings are empty now. So Unity.
Yeah, I'm sorry. I wanted to give you a breather. You hit the nail right on the head. What happens to the many patients that you guys have to see with? So you said you had about 25, 30 physicians walk out. So
Yeah, and it
what
just
happens with
continues.
the care of the citizens that those doctors were seeing? How are you
Oh, we
managing?
don't know. And I'll give you an example. The most recent example is a doctor whose desk was next to mine. She had been there for 24 years, and she said she was tired of being lied to, and she left. So, today one of her patients came to see me. I don't know. I think I don't know what's happening to most of them. And I was all prepared to go to bargaining and say to Tracy Harrison, the chief operating officer, well, who's taking care of these patients? Because my panel's already full, but every time a doctor quits, a patient will come to me with their eyes, kind of beseeching eyes, the big eyes, and they say, will you be my primary care doctor? I can't say no, but I already have a full panel of patients and I don't want to quit. I've made it very clear. I'm not quitting. I'm 63. This is where I'm going to stay till I retire, God willing. And the union has given me safety that I can speak out and not be fired. I'm so grateful to union protection, but people come to me, will you be my primary care doctor? Because so many doctors have left. I say yes, but at the end of the day, when it is 6 o'clock, I leave. And, Unity hasn't said, well, what's the master plan? Where are these patients going? As bad as it is at Upper Cardozo, the word has it that it's way worse in Ward 7 and 8. There's the Anacostia Clinic, there's the East of the River Clinic, and maybe patients can go to Mary Center in Northwest. I don't know. I know they're very overly filled also, but who's taking care of all these folks in you know, in Ward 7 and 8, nobody seems to care. And I'm sure the ERs are getting overwhelmed. And we know what happens if you have high blood pressure, if you have diabetes, you know, these conditions that have no symptoms. We know that you're at high risk of stroke and heart attack and kidney failure if you don't take your medicine. We know. And you know, management won't even talk to us. The board won't talk to us. So we need to make a lot more noise, and it's going to have to fall to the community and the DC government.
Well, I'm glad that you ended there because I want to segue. What have you guys heard in way of the DC government? What is our leadership doing? Are they involved in your conversations at all? Have you received any type of guaranteed support from the DC government leaders?
No, so we met with them. We met with most of the members of the council, and you know, basically, like Christina Henderson apparently is the chairman of the health committee. She sent a scolding letter to Jessica Boyd, the CEO. But you know, we have learned now just a meeting with them, approaching them once is not going to do it. We're going to have to really, really put heavy pressure on them, and that's where community members play a role too. That you know, our council members work for us, and you know, it's their job to make sure that DC residents get health care.
I agree with you. Now, when you talk about getting the community support, what's ideal in you all's circumstance in terms of, because you mentioned you have a vote with the union coming up. What happens if you're not favorable in this vote, and how can the community support you going
Well,
forward?
I mean, I'm not a labor specialist, but the vote will be tomorrow for the support staff. So, you know, there are two completely separate unions at play here. We have a union, we don't have a contract, and management's trying everything in their power to never give us a contract, which I understand is standard management practice. You stall, you stall, you stall. So we have a union. The doctors and providers have a union. We have no contract. But tomorrow is the vote for the support staff. If the vote fails, then I think they have to wait a long period of time before they can vote again. But there are a lot of people tomorrow that are not included in the vote. So I think there'll be a third round of voting. Management managed to exclude the security guards for tomorrow. The nurses are excluded, and environmental services, the people who keep the building clean, and the social workers were excluded. So presumably there will be another round. No matter what happens tomorrow, there'll be another round of voting with those excluded staff members. But in terms of us, you know, we need no justice, no peace, I think, among the city council, and among the mayor, and among, I believe, Wayne Turnage is the director of the Department of Healthcare Finance. And apparently he has power over what's going on. I only learned all of this last Tuesday, just a week ago. But the people in our government need to not, you know, there needs to be unrelenting pressure until DC residents get dignity health care. And the other thing management is playing a game with is they're spending money hiring temps, doctors that are temps. So they pay a lot more money to go into a temp employment agency to get a doctor for 3 months. And they've completely disrespected the concept of continuity of care. You know, vulnerable, sick people need a continuity primary care doctor and not a temp. You know, this is not a CVS where who's ever behind the who's ever at the cashier can handle you. No, our patients need continuity of care. I mean, think about the patients who lost their doctor of 24 years. And our patients are vulnerable. They have chronic medical conditions. And, you know, we do a lot of cancer screening and all these things. And we were on the front lines of COVID, and we were on the front lines of giving vaccines to people who are vaccine hesitant. You know, through our long-term continuity relationships, we were able to help with the COVID, to give vaccines to people who are hesitant, you know, cancer screenings for people who are hesitant. You know, I had a patient today who lost his doctor and lost her doctor, and she had had a cancer. She had had a known cancer, and she didn't want to treat it because she was fearful of going to the oncologist. And, you know, without the relationship, and she was the one pleading with me today, will you be my primary care doctor? And I said, of course, because all I want is for this woman to get the cancerous tumor removed. But, you know, I can only see so many patients in a day. So, you know, the DC government, the mayor, the council, Wayne Turnage, all these people need to hear from the community until the situation is made right. And we are calling for the resignation of Tracy Harrison, the chief operating officer, and Jessica Boyd, the CEO, because they're the ones driving this over the cliff.
Well, I thank you so much. And it's interesting you mentioned the continuity of care. Guys out there, I need you to understand, just imagine building a relationship with your doctor for all of your personable healthcare needs and concerns, and then one day realizing that that doctor's relationship is no more, and then finding yourself having to get in line. Many people showed up for appointments and had to just wait and just wait and not know how long it would take before they could see someone. And as you hear Dr. Sugarman mentioning, she already has a roster of patients, but now she's doing everything she can to try to help patients who no longer have that relationship in place. And these are patients, you know, in our communities, our lower income and our minority families and our underserved community and population, we have healthcare ailments, right? We have diabetes and dialysis and high blood pressure. And as you hear Dr. Sugarman mention, our cancer screening, which is showing up in our communities more prevalently now. Guys, this is a travesty out there. If there's anyone out there who understands the urgency that this represents in our communities, why we should be up in arms is because we're looking already at a city that's not really divvied up the healthcare outcomes the way that they should. We already are facing disparities in our care. And now on top of that, we're hearing that our underserved populations, our homeless populations who depend on an ability to see someone as they are managing their lives temporarily in the streets and in the buildings and settings, they were able to go to a Unity healthcare clinic across the city and be able to receive the care that was necessary to prolong their living. And I want you to think about something out there. Imagine being in a jail cell. Mr. Roach Brown, one of our colleagues at the table, he pointed out that if you've got a toothache as a prisoner and you're waiting to see a doctor and the doctors are dealing with something as serious as this, can you imagine what it would feel like standing in line at the jail waiting to have a toothache looked at and possibly not being able to receive that care or any other health ailment? Guys, this is real. If you have loved ones that are in the prison system in the district, if you have loved ones or family members or community members that are struggling with homelessness, many citizens show up on our doorstep every day and they don't have the necessary resources they need. They can take comfort in being able to receive health care in one of the Unity Health Clinic settings. So this is very impactful for many members in our community. And Ms. Sugarman and her colleagues have been extended an invitation to join Healthy DC's Human and Civil Rights protest on Labor Day, where we want them to take the microphone. We want to add to the pressure that they want to place on the mayor, on members of the council, on the health department, Mr. Wayne Turnage, and also for the fact that they're trying to get these executives out of there, Ms. Harrison, who are not showing scrupulous practices in helping negotiate these contracts. Now, Kate, you mentioned, or Carrie mentioned, that if the overall voting is not successful, at some point, you guys are going to move to an authorization to strike. Is that your understanding?
Yes, the votes will come out tonight. It's a 48-hour vote counting process. So I will email you just as soon as I know. We will have a press release, and we really want more media attention on this. And I think tomorrow night, I have to work late tomorrow night, but you might have seen in the email that WUSA Channel 9 is going to be at Busboys and Poets. So we're going to try to have union members there. I wish I could go and I can't, but right. Another call is for media. WPFW has been a huge fan. I mean, I got a text from a friend last night. It's like, oh, I heard you on the radio. So yeah, we got to get the word out, and we're gonna have a press release tonight. And the Washington Post did a great article, and that was already a few months ago. And since the time of the Washington Post article, things have gotten really, really disastrously worse. But yeah, the more media, the more attention. And I want, I would love, I'm not a lawyer, I would love the Attorney General to be involved. Who is paying for these lawyers and our Medicaid, for the union vote tomorrow, people were getting cards saying that, despite 46 people being abruptly fired, 46 low-wage workers, Jessica Boyd makes $400,000 a year. Well, these are Medicaid dollars. She's not fundraising this money. We know they don't fundraise. God knows what Tracy Harrison is earning. And I took a walk through their corporate offices about a couple of weeks ago, and there are halls and halls and halls and halls of empty offices, on prime real estate. Well, again, that's our tax dollars. Don't talk to me about a 30-year lease. Who leases a place for 30 years? Whatever. We need a big shakeup. These are our tax dollars, and these are Medicaid dollars.
Absolutely. Absolutely. And as you mentioned that, I want to call our viewership's attention to the fact that we got to have oversight in our government on matters such as this. Do you know that Prestige is a former mental health core service here in the district, and they are in court as we speak because they were overbilling Medicare and Medicaid for citizen services. And so when we don't have government oversight, there are all kinds of things that can take place. In fact, we have to pay attention, and we have to speak up. I want to really quickly plug Timon Freeman. Timon Freeman, We Act Radio, is actually challenging Eleanor Norton in this election. And I want you to know that he's been very active in this movement of protection for Unity Healthcare and helping to get this word out. Tomorrow evening, if you're not doing anything, and even if you are, maybe you might want to reconsider and start getting more involved on this community level. Dr. Sugarman has been working all week and dealing with this for a few months now, and the reality of her making time at 7 p.m. to come on so you guys can get the information so that you can stand up while DC leadership, stand up to, as you heard her say, the Office of Attorney General. Start asking questions, right? Pressure on your local council member to do something about this, because it's not okay to have so many DC citizens' health care in jeopardy, and it's definitely not okay to have workers fired the day of to get them out of voting for a union vote that's necessary. And also, what about our doctors? Our doctors under distress while trying to take on more patients to cover the shortfall. By 625 Monroe Street Northeast, in Washington, D.C. is where the Bus Boys is at the event tomorrow. Timon Freeman is hosting, and it's called They're Trying to Kill Us. It's a film screening that's basically pointing your attention to a lot of the things that are going on in and around not just the nation's capital, but across the nation. And we've got to be more woke, more aware, more educated. All you have to do is just show up. So, Faith, I want to talk to you a little bit. I saw that Timon sent an email around saying that WUSA 9 was going to be there, and I'm so happy to help with getting this word out. But will you talk to us a little bit in the space of, for example, over at the jail? Or actually, let me stop for a minute. Approximately how many doctors would you guesstimate are still in the system working?
Well, we've had so many people quit. I know, if we're providing care for 90,000 people, I think we're down to, if you add up like 2 part-times count as 1 full-time, I think we're down to like 40 full-time people for 90,000 people. I cannot speak to the jail at all. I've never worked there, but I believe these are just like Carrie would know better, I think. And Unity keeps no records at all. I don't know who works for them. It's crazy. But I can tell you at Upper Cardozo, a 4-story building, which used to be very hopping and busy, 4 floors of patient care. I am now the only full-time primary care doctor left.
Wow.
We have part-timers, but yeah, it's really, it's very few. It's
Pretty
very, very,
nice.
Yeah,
Yeah,
that's very
that's
dire.
unfortunate. You know, when we talk about standards of care, how on earth about you said you're seeing about how many patients a day now?
Well, they want us to see 26. Often it's less. But here's another funny thing. One of the brighter things that came out of COVID, obviously a pandemic where so many people died is not a great thing, but we did learn how to do telemedicine. And it was a very clever pivot that we could still keep the lights on by calling people in their homes. No technology at all. Our patients are very low in technology. We would use our landline, call them on their landline or whatever. And we could refill medicines, and we learned that insurance pays for blood pressure cuffs and people could check their blood sugar at home. So we really learned how to take care of a lot of vulnerable people using telemedicine, and insurance would pay, reimburse us for that. So we've been fortunate that we can still, 1/5 of my week is still telemedicine. I'm mostly in person, but I have one day a week, one full day a week of telemedicine. And it's great. I can send out the cancer screenings, and I can order blood work, and I can refill medicines, and it's very useful. I can follow up with people who are getting lost to care. So people have asked Tracy Harrison numerous times during bargaining sessions, oh, well, how much money are you able to capture in billing through the telemedicine? And she keeps saying, I don't know. What are they doing in that corporate headquarters? I mean, because our patients lead very busy, stressful lives. They work multiple jobs, they're caring for sick family members. And so telemedicine has been a real blessing. And so when a patient no-shows, and no-shows happen a lot due to their busy schedule, we can just pick up the phone and say, oh, Mrs. Jones, you have a UTI, you have a urinary tract infection. Are you allergic to antibiotics? Let me send in your medicine. Oh, your cancer screening came out abnormal. Let me send you to, a breast specialist or a colon specialist. We can do that on the phone. Well, are we getting reimbursed for that? I don't know, because Tracy Harrison won't answer us. It's got to be a yes or no question. How much money are you getting back in the telemedicine visits?
That's
We
unfortunate.
need more
Well, you
oversight, and yeah.
Yeah, there are people that are hearing this for the first time, and I'm sure they're processing it pretty fast because, it's a lot to take in. You just wouldn't imagine that in 2024, we'd have a doctor appearing before us, in as much distress for doing something that should be secondary, should just be ordinary. Everyday lives depend on our doctors showing up and being able to provide the necessary care. So I want to break down for our viewers who are just hearing this information and getting their arms around it. Talk to us about the contract negotiations. Carrie pointed out that there were three basic things that were being asked for: safety, transparency, and you all's ability to see lesser patients. Can you kind of take us into that a little bit more deeper to help us understand what happened that all of a sudden safety became a question? Same thing with the transparency request, and then also why all of a sudden they want you to see more patients.
Well, the safety, I don't know if that's more of a jail question. It has not been a personal issue for me. So I don't know, and I can't speak to the other side. So safety, I can't speak. The other issue is I'd never been to a bargaining session, and I was so excited. I was going to go yesterday. And I had all my lines. Jessica Boyd has never come to a bargaining session ever, even though she's the CEO and she is a doctor. But Tracy Harrison attends, and I had all my questions lined up for her. I said, well, who's going to take care of all these patients when the doctors leave? I've got, I can list the doctors, who's going to take care of Dr. A, Dr. B, who's going to take care of all these patients? What happens to all the high blood pressure, diabetic patients who go without their medicine? So I had all my questions lined up. All I understand from previous sessions, because we get updates, we've been advised when you have your very first contract, don't negotiate for the sky and the heavens and the earth. Be very focused and narrow. We've never asked for higher salaries ever, even though Unity pays below market to the doctors. 400,000 is a very generous salary for the CEO, but they always tell us keep it very narrow. So the thing that we've really tried to focus on is, okay, here's a narrow demand. We want to limit the number of patients that we're forced to see in a day. That's all. So the scheduling, let's limit it to the scheduling. And I'm incorrect with the numbers, but an example I kept hearing was from the bargaining team. Bargaining means you come to a negotiation, you meet in the middle, right? So, the doctors would say, okay, we want a maximum of 18 patients in a day, and don't quote me. And then management would say, no, we want 26. And then they would never budge. And you think of a bargaining, okay, all right, 19, okay, 25, no, 26, 26, 26, 26. So, and it used to be that at the end of the session, sometimes the union would say, you know what? I think management is starting to budge a little bit. I think they're starting to soften up. I think we can work something out. And that happened. And again, I wasn't there, but it happened at the last meeting. I think we can come to some kind of bargaining, some kind of compromise with the schedule. And then about 3 days after that most recent session, management sent out a blistering email saying, well, management said, well, we can't talk to you. We can't work with you because somebody used a curse word. Really?
Wow.
And I wasn't there, but really, they're just making excuses. And the fact that they canceled the rest of the August sessions, we voted for the union in December. It is now August. And I believe their excuse for canceling all of August is, oh, we have a new law firm. Well, I can't even imagine what this law firm's getting paid, but you know what? I bet they could catch up over the weekend and get up to speed. But so now we don't have a single future date for bargaining because I try to block off my calendar. Well, I know August they've completely canceled. So it's just, yeah.
So this just keeps going on and on. In a perfect world scenario, if you had your way, how would you be made whole in this?
I mean, in a perfect way, we'd have Tracy Harrison and Jessica Boyd no longer work for them. And we would have management that is accountable, that is transparent, and that cares about the well-being of patients and staff.
Yeah, and it's interesting that you say that because if you go to Unity's website and you look at their mission or their core values and all, it reads well, but it's such a contradiction to what you guys find yourself going through. And am I remiss for assuming that the predominance of the patients you care for are African American?
It's a real mix, and I think it depends on the neighborhood. I don't work in Ward 7, Ward 8. I believe that's more African American.
Mhm.
At Upper Cardozo, it's a real blend of, African Americans, a few white people, and, immigrant brothers and sisters, Spanish speakers, and Ethiopians, and a mix of immigrants from all over. I mean, it feels like a beautiful place in that it's so multicultural and we've been able to get along, multicultural staff, multicultural patients. We all try to learn each other's languages, and learning about each other's cultures. And I always felt like I was blessed to work in such a beautiful, mostly harmonious place. I just can't believe what's happening because I've been so happy at Unity. I've been so happy that I can see people who are underserved, people who are low income, and I can provide them with the care that I would want for me and my family members, for the most part. It's the buildings aren't fancy, but I feel like until everybody left, I was feeling proud of what we were doing.
And are any of your patients youth and children affected by this at all?
Yes, I don't treat children. Oh, it's horrible. We had so many pediatricians leave. I can't even tell you. So, yeah, it's really so many pediatricians leave.
Yeah, and I appreciate you answering because I'm just trying to get my audience to understand the magnitude of the impact of this. And then in DC already, with our women who give birth, there's already a challenge for where you can find a facility to do so. And as a matter of fact, I believe that you have to travel to the west side of the city in order to even be able to do that. Did Unity participate in helping women to give birth or in their birth plans?
Well, there's, they have a large obstetrics practice.
Mhm.
So, yeah, there is, there's a large practice of obstetricians who are wonderful, obstetricians and midwives, and they do a fantastic job. Yeah.
So this all impacts them and their services as well.
Yeah.
How
Yeah.
about dentists? How are you doing with your dentistry, your dentistry services? Is this impacting them as well? I just want my audience to understand it's really across the board, correct?
Right. I mean, we have a large dental practice. Yeah. We have, in the entire Upper Cardozo, which is our largest clinic, we have not one therapist, not one mental health clinician. Um, and that's been actually for a while. There's one for children and zero for adults. Um, yeah. Because, Unity tries to be holistic. They try to be multidisciplinary, but we have one psychiatrist who covers many sites. Yeah, I mean, the shortages are,
Yeah,
yeah,
and
it's dire. It's true.
yeah, and as a mental health advocate, I think about my homeless and my incarcerated citizens because they're generally ones who are not getting what they need already from a resource standpoint. And then you throw into the mix that the healthcare provider that they're dependent on is actually going through this, and that, like you said, the union would risk spending dollars on high paid salaries for executives and get these attorneys to go back and forth with you all. And it's just not acceptable. And what's really surprising to me is that we haven't had a DC leadership that has been more proactive in this because of the negative impact to our citizens that we're already challenged to help take care of. Kate, take a breather for a minute. Thank you so much. Guys, this is your girl. It's your girl. It's Rhonda, and it is coming up on the hour. We are speaking with Dr. Kate Sugarman of the Unity Healthcare practices. If you haven't heard, they're in heavy contract negotiations. They had to go and get unionized because they were being treated unfairly by the executives that employ them. And just recently, as many as 40 support staff were let go on the day of, just so that they would not be able to participate in a union vote in order to fix this mess. And as you heard Dr. Sugarman say, there are folks at the DC Department of Health in charge of healthcare finance that should be very concerned that these negotiations are not taken care of, or that they haven't found a medium point. I want to ask some of my folks on the line to unmute, and maybe there's a question or a comment for what you're hearing. Welcome. I have a caller, 517-4576. Would you like to unmute and weigh in? Welcome to the Palms Up Show. Palms up. And in the meantime, Ms. Carr, do you have any questions or any comments or anything you'd like answered as it relates to this Unity healthcare crisis? What comes to mind when you hear something as egregious as this in the healthcare of our citizens? Oh, okay. Hi, Ms. Carr. Welcome to the Palms Up Show. Palms
Thank
up.
you. Thank you so much, Rhonda, for just hosting this. I'm just overwhelmed. Thank you, Dr. Sugarman, for the information. I'm just really overwhelmed at what I'm hearing. I knew things were bad here in the district, but it just makes me cringe every time I get on one of these calls and just here is something else. It never ends. So I definitely want to come out tomorrow and learn more and offer support wherever I can. Thank you again for the information and for hosting, Rhonda.
Thank you, Ms. Carr. Ms. Carr, Dr. Sugarman is an avid activist as well and has been very supportive of the efforts of the Healthy DCME Leadership Coalition in the community. She's a resident and native of the district, and so it's important that we help our folks of the district just understand that there is yet another thing going wrong in our system. Overseer Coles, I wanted to invite you back to the table. Thank you, Ms. Carr. If you could unmute, did you have any comments or any questions, dear Queen?
No, I'm not surprised when it comes to the district, but it's really happening in our medical system across the country. Having an opportunity to travel to different communities. One of the biggest disparity is medical providers. And in some ways, COVID, I think, hurt the medical system because they went to telehealth. And to be honest, telehealth is a lot cheaper for upper management. because they say the doctors don't need offices, you don't need the receptionists, you don't need the nurses. All you need is a telephone, and you just send a person to a lab. So that has kind of hurt. But I also see where telehealth have hurt because a lot of patients have died being on telehealth because a lot of things were left undone, left untreated because the doctor couldn't see you face to face. And it really disturbs me when it comes to this medical health piece. There's already a shortage of healthcare providers. And I'll be very transparent. It took me forever and a day to get a healthcare provider for myself. You know, being in the position I hold, I have to take in a lot of stuff. So you got to have somewhere to release. And the sad part about it, once I got comfortable with my therapist, health insurance, because of health insurance, it stopped. And you're right, they want to treat our medical system as a buffet.
Mm-hmm.
That's just what they want to do. Everything is buffet, or should I say microwave. And
Mm-hmm.
you know, microwave do a lot of damage to the body. They trying to kill people off. I'm gonna just say it like I feel it. Because they talk about ain't gonna be no social security, so they gotta start killing folks off. What better way to do it than through the medical system?
Well, you have definitely given us a wonderful segue to tomorrow's event. Thanks, Overseer Cole. Palms up for all that you shared. Tomorrow evening, guys, over at the Busboys and Poet on Monroe Street in Northeast, Kimon Freeman is hosting a film screening. They're trying to kill us. It is important that we understand that having our voices and not using them is just like being okay with watching our citizens receive less than favorable health care. And in many cases, as Overseer mentioned, if they don't get the care that they need, they're going to die. They're going to die or they're going to dwindle further into that ailment. And it is so important that as citizens that we start speaking up. See, we got less than 26% people showing up to vote. Does that really mean that we don't care? No, it doesn't mean that. It means that many folks, I can only speak for the populations that I'm most familiar with, we get emotional and we just withdraw, right? We see things going on in our community that are unacceptable. We talk amongst ourselves, but very rarely are we showing up to rally. You know, the kind of rallying that our ancestors did, people marched here barefooted because they believed in what it was that they were fighting for, which was justice. So what does modern day justice look like is the question. Is it okay that brown and Black families are struggling to figure out their healthcare outcomes because we're waiting for unions and executives and DC leadership to show up and to provide the proper level of leadership? As before I invite Ms. Sugarman, give us her closeout word. What we're asking you all to do on Labor Day, you know, we like the barbecue and picnic. I keep saying it, palms up. And there's plenty of time for that. But on the morning of September the 2nd, we will be at Freedom Plaza in Northwest Washington, D.C., 1325 Pennsylvania Avenue, directly across from the Wilson Building. Well, why are we having a human and civil rights protest? Because it is important for citizens of the district, citizens of the nation's capital, to understand that you don't adapt. You don't adapt to circumstances that violate the rights. Tax dollars are being spent for high-level executives to run these corporations the way that they are. And as you hear from Dr. Sugarman, they're down at the bottom trying to figure it out, trying to make sure that these patients receive care because the money's being taken out of it. And as a nation's capital, we ought to be the type of citizens that show up and call our government out. We ought to be the type of citizens that show up and vote them out. In matters of public government, the power rests with the people. But when the people go quiet and don't show up, then the media spin and everything else starts to spin in the favor of the folks that are taking advantage. And did you think we get out of this hour on Palms Up without recognizing that we've had a local council member locked up on allegations of bribery. Well, when we take our eyes off of the prize, when we don't hold their feet to the fire, there is too much room for them to get in trouble and hang themselves at the dismay of our citizens. In the one ward in this town that is seeing the less of healthcare outcomes, that is seeing the less of economic understandings, that is graduating the less children to higher education, that have food shortages, you name it. Crime is running rapid, mental health is not adequate. In the one ward where we need everything on the buffet, he would have the audacity to find himself with allegations of bribery. Guys, pay attention. Pay attention. This is real life stuff. Every citizen of the district should have the ability to be able to build life-sustaining relationships with medical professionals. Our medical professionals should not be undeceived for trying to provide care for too many in a system that's not being run properly. There ought to be a standard in this town that says you will not operate this way, and nor will you put our citizens' lives in danger. Thumbs up. Guys, if you're looking for a place to use your voice, if you're looking for somewhere to show up and be heard, that would be at Freedom Plaza on Labor Day. You can cook your hot dog when we're done, but 11 a.m. to 2 p.m. we will be at Freedom Plaza. And we've invited the colleagues, our dear colleagues from Unity Healthcare, to add to this protest because it is a blatant violation of district citizens' healthcare rights when they are not able to build the continuity of relationships needed to keep their livelihoods safe and their well-being properly cared for. Kate, before we leave, would you please give us any closeout message that you feel?
Yes, I'm going to give you a closeout message just to keep everybody fired up.
All right.
If I were a manager at Unity Healthcare, I would be worried about the health and safety of my staff and of my patients. But this is what the support staff walked into work. This was what was blasted out in their emails. If everybody can see this, management was spending their time trying to intimidate the support staff, saying, vote no. They're trying to intimidate them to vote no in the union. They are lying to them about what it means to be a union member. I know that being a union member gives me protection. It allows me to speak out. So management, instead of caring about the health and well-being of their staff and their patients, they're wasting time intimidating workers. And, no justice, no peace, no, until we have, if we don't get no justice, they don't get no peace, and we need our good health and we need our safety, and we will fight this together. And the one thing I keep telling my workers, because morale is so low, I said, you know what? This clinic belongs to us. This clinic does not belong to Tracy. This clinic does not belong to Jessica. This is our clinic. We will take it back.
Amen. Amen. And this is our city, and we will take it back. It's your girl. It's your girl. And just like that, the hour is up. But guys, I tell you, if you are frustrated, motivated, and you want to use your power for good, first and foremost, share this feed and get folks motivated about showing up on Labor Day. And if they don't have anything on the calendar for tomorrow, and even if you do, consider stopping by Busboys over on Monroe Street in Northeast, where Kamon Freeman is hosting a film series. They're trying to kill us. Guys, the first thing about mobilization is about getting the education. And here on the Palms Up platform, we're not going to steer you wrong. We have our eyes and our ears on the ground. We're watching that kingdom, and no one is off limits when the health and well-being of DC citizens are in jeopardy. Mental health will always matter. And anyone going through these types of negotiations and these types of frustrations definitely have exposure to unnecessary levels of stress, anxiety, which can lead to depression. So guys, we got to talk about it. Thumbs up to all of our workers of Unity Healthcare, first and foremost. If you yourself are a patient of Unity Healthcare, please, when you go in, let them know you heard about it on the Palms Up show. You stand with them in unison, that you will join the citizens' protest on Labor Day, Monday, September the 2nd. www.healthy healthydcandme.org is where you can sign up and get more information. I want to thank our dear Dr. Kate Sugarman, who is not just a doctor, she's an activist as well. And one of the first things I remember her saying when she came on the call that we were speaking on, she said, let's go to the street. You gotta take it to the street. You gotta get the people involved. That's exactly right. Dear Dr. Kate Sugarman, I tell you, if I was in need of a doctor and this wasn't an issue, I would love to have you. You want somebody caring for you that cares for our city as you do. So thank you so very much. Palms up to you, my dear sister in the fight. And I will see you. You said you may not be there tomorrow, but I'll definitely be talking to you.
I have to work late tomorrow. Yeah.
Okay. Well, God bless you. We'll be thinking about you. We thank you for taking time tonight. We will be in unison on those planning calls. And on Labor Day, I look forward to having you or Jimmy or whoever on
Yes,
the
I
line.
plan to come. I'm hoping to come. I'll be traveling, but I'm taking a red eye Sunday night. Because I'm not missing that. So if
That
the
is
plane lands on time,
dedication.
I will be there.
Well, you just know that all of our audience at Palms Up, as well as the Healthy DCME Leadership Coalition, we stand with you all. And if it has to go to a strike, we'll be out there holding those signs with you all. God bless you. Thank you so very much. And please give our love to the whole staff back there. Tell them we're with them. And we're going to get this boosted so that it circulates all over our social media platforms. Kate, thank you so very much. You have a wonderful evening.
Thank you. Thank you all. Thank you for including me. Thank you. Thank
Not
you
a
for the
problem.
solidarity. Thank you.
Not a problem. Palms up out there. All right, the bats in the sky, the babies in the sky. The word is go. We'll see you tomorrow night. If not, we'll see you Monday, September the 2nd for the Citizens Human and Civil Rights Protest. We're calling out the OAG, DC leadership, to include the mayor. We're talking to the healthcare department, Mr. Wayne Turnish. We're calling them all out. There's a manifest that's being presented to the OAG because we're tired of the rights of DC citizens being violated and there not being proper legislative enforcements in place. And they should be questioning the Unity Healthcare executives for spending all that money for attorneys while the healthcare of our citizens are in jeopardy. It's your girl. It's your girl. Let me know. Talk it up. Share this feed. Thank you so much. See you next week. Palms up to you all. Thanks again, Kate. Bye-bye.
Thank you.
Dr. Harrison,
Yes.
what time is the event at Busboy and Poet tomorrow evening?
Oh, wonderful question. 6 to 9 p.m.
All right, thank you.
You're welcome. Talk to you all later.